Hello, my name is Norma White, and my research proposal is about exploring tapping as a means to reduce anxiety in school-age children. The Anxiety and Depression Association of America tells us that anxiety disorders are the most common disorders in adults, and that nearly 8% of children 13 to 18 experience them as well. Now, this could be caused by several factors: stress at home, stress at school, overscheduling. You couple that with a disorder like ADHD or autism, and it's a pretty stressful place. School can be a place of constant turmoil for kids who are experiencing anxiety with those other mental health disorders. With the need to constantly be flexible and changing classes and subs, and constantly having to adapt to unclear social situations. Test anxiety also factors into kids at school experiencing stress and anxiety. So usually this anxiety is treated with either cognitive behavior therapy or medication, or a combination of both. While medication can certainly be helpful, the National Institute of Mental Health tells us, as do many other sources, that there are negative side effects to consider with these antidepressants and anti-anxiety medications. They can cause nausea and headache, they can cause sleeplessness and irritability, and in rare instances, suicidal thinking. Additionally, students and children may grow to need more and more of the medication as they get older, because their bodies begin to metabolize it, kind of creating a dependency situation. Meditative approaches have been shown to be successful with several studies. Mindfulness, in the book The Mindful Child, is described as quieting your mind and just experiencing what's happening without any emotional charge. You just experience things with no emotion. Typically in mindfulness and meditative practices, the focus is on the breath and breathing. And so the mindfulness has been shown to be to be effective. Simple, Reed, and Miller led a study in 2005 in which they explored teaching meditative and mindful practices to school-age children. They had a small sample of 5 students, ages 7 and 8, and each of those students at the end of their study had shown success and improvement. In 2011, Greenberg and Harris also led a study in which teachers led students in a 10-week practice of mindfulness and meditative practices. At the end of the 10 weeks, the 4th and 5th graders reported that they had an improvement in their self-concept, and the teachers reported an overall improved ability in all of the students to focus and pay attention. Mindfulness has also been shown to reduce test anxiety, social anxiety, and psychological anxiety. Eye movement desensitization and reprocessing, or EMDR, is another method that has been shown to successfully treat anxiety. Now, EMDR was developed by Dr. Francine Shapiro with a focus on processing trauma, something extremely traumatic like rape or prolonged abuse, or it's been used extensively in PTSD treatments. She wrote a book, Shapiro, and she wrote a book and talked about how trauma with a capital T, the rape and the abuse and things of that nature, do need to be worked out, but there's also trauma with a little t to be worked out, and that she describes that as everyday, daily pressures. So EMDR works like this. It focuses on a negative thought, a negative memory that you have, and you focus on that thought and you engage the brain in bilateral stimulation. That can look like back and forth movement of the eyes from side to side. That can feel like, I've seen it used with paddles in the hands that vibrate while you're thinking about this trauma. You can even tap your feet back and forth, sounds, any number of ways, but the back and forth movement is what has been shown effective. Now, they can't really explain why it works, but it's been discussed that improper traumatic memory is stored improperly, and by engaging the brain in bilateral stimulation, it allows that to be processed correctly. And so there has been success shown with treating anxiety and anxiety-related disorders such as obsessive compulsive disorder with EMDR. My research would focus on an EMDR-related technique called tapping. In her book, Dr. Laurel Parnell, Tapping In, she describes tapping as similar in nature to EMDR, in that it engages in bilateral stimulation and but it focuses on visualization and the positive. EMDR again focuses on the negative. Tapping focuses on a positive. It uses elements of mindfulness in that there is controlled breathing, and again that positive imagery. It's emphasized throughout her book that if the image that you're focusing on becomes negative or uncalm, tapping should stop immediately. Because anxiety that goes untreated in children can lead to negative, harmful effects, either through their social lives, through risky choices, engaging in substance abuse, and the possibility of poor academic performance. My research question would focus on will tapping effectively reduce anxiety in children? So in my mixed method study, I would attempt to obtain a purposeful sample of students in 3rd, 4th, and 5th grade, about 3 or 4 students each. I would survey the teachers and ask them for their input. Who in their class do they know has anxiety issues, either through parent disclosure or that maybe the teachers observed them. Once that had been narrowed down, I would contact the parents and obtain informed consent from them, explaining that there would be a little bit of a home component as well. And then we would go about beginning our study. 2 points of interest about the sample. I will not be considering medication as a factor for either inclusion or exclusion of this in the study, and whether or not a student is receiving special ed services for autism or ADHD would not factor in to my sample either. So I would use 3 instruments in this assessment. The first 2 would be for the parents and the teachers. It would be 2 checklists, each from the Behavior Assessment System for Children, the revised edition. The teacher checklist has 139 behaviors on it that the teachers rate from always or never, I believe it is, or almost always. And the parent rating scale is similar with 160 behaviors. The students will also be asked to complete the revised Children's Manifest Anxiety Scale to shed light on any internalized anxiety. Those 3 measures would be completed pre-test and post-test. As my quantitative measures, those would be scored, and a paired sample t-test would be conducted to determine if the results were statistically significant. So during the study, I would also ask each child to complete a 5-point anxiety Likert scale. We would focus on an anxiety-provoking thought in each session, and then we would practice tapping, and then we would have them circle on the same Likert scale in a different color how they felt at the end of the session. So I would begin my study by just bringing the students in and talking to them about what makes them feel anxious, how their bodies feel when they're anxious, and asking them to complete those measures, of course. And then we would talk about things that help them calm down. I would use a couple of books that I have on mindfulness and imagery. If some of them are having a hard time finding an image, we would talk about maybe a peaceful place or a person that helps them calm down, and we would really focus on that. I would encourage them to close their eyes and really experience that from every sense. What does the memory or the image sound like, look like? What does it feel like? And then I would model breathing for them, controlled breathing. It's been my experience that children have a hard time controlling their breath and slowing it down, so we would spend quite a bit of time on this. breathing in for 4 and out for 4, with their eyes closed, thinking about that image. After that, I would show them how to tap, and it might look like their hands on their knees where they're tapping side to side. Dr. Parnell also says that you could do a bear hug and tap on your shoulders, but I would explain that that helps our brain store that image faster and easier, so that when we begin to feel stress, we can think about that image more easily. I would encourage them again to stop if any thoughts become uncalm. So we would work through that for a while, and then at the end of the session I would go over the homework component, asking them to practice 10 times over the 6 weeks with the prize, of course. So we would follow that pattern for each of the sessions with the anxiety-provoking event and tapping, and then scoring it again. At the final session, I would obtain qualitative data. I would ask them, what did you think of the class? Did you find it helpful? What did you find helpful about tapping? Or what did you not like about it? And will you continue to use it? I would also at this point ask the teachers and the parents to complete those scales, and the conversions would be done and compared. Some things to note about my limitations in this study. While I didn't let medication be a factor in the sample, if a student is on medication or is not on medication, any change in that during the study could impact the results in one way or another. Additionally, whether or not a student was in special ed or not did not factor in. However, I know that students who are in special education for autism or ADHD sometimes have received previous training in self-calming techniques, and that may impact the results of this study as well. And of course the parent component, if they have their child practice, if they're using consistent language, the results may be better for one child than another in that regard. Suggestions for future research are to explore tapping in comparison to medication. Also, more studies should be done with a broader base of a sample. Some of the studies I read were for high school, some of them were for younger children. My sample would be pretty much upper middle class, socioeconomic, with educated parents. It would be interesting to practice this study, or to do this study with a different demographic. Specifically, I would be interested in further studies with women, because the World Health Organization tells us that women are far more likely to have an anxiety disorder than men. Also, a bit of personal experience here. All of the teachers I know who have had gifted children in their classes observe that those children have very high levels of anxiety. Being intellectually above their peers and struggling to fit in addition to the constant pressure some of their parents put on them, really causes some high anxiety levels. So it would be interesting to do a study and see how that impacts the effectiveness of tapping. So given the potential harmful effects of medication and the potential harmful effects of untreated anxiety in children, it is my hope that students could learn to effectively use tapping as a means to reduce their anxiety, not just in childhood, but for the rest of their lives.